I'm Shannon Hamaker, a sexual health educator with A Step Ahead Chattanooga. Welcome to our birth control video series, where we will explore the different birth control methods available today. While new options are always being researched, this series focuses on methods currently accessible and on the market. Our mission at A Step Ahead is to remove barriers to contraception through education, outreach, and access to free birth control. If you're in our service area, check out the description for details on how to get started with a free birth control appointment and other resources like blogs on what to expect at your appointments, tips on preparing for your appointment in the clinic or through our telehealth partner. One of the most common questions we hear is, what's the best birth control method for me? Honestly, the best method is the one that works best for you. If you tend to forget things, a daily pill may not be ideal. But if you already take a daily medication, adding a pill may not be that big of a deal. So take a moment to ask yourself what matters most to you. Do you prefer something non-hormonal? Do you want to have some help to control your periods? Or are you looking for the most effective pregnancy prevention? Keep these questions in mind as we move forward. Now, before we dive in, let's do a quick anatomy refresher. Here's an internal view of a person with a uterus. The key parts we will talk about include the vaginal canal, the cervix, the uterus, the fallopian tubes, and the ovaries. Pregnancy happens when sperm meets an egg during ovulation. If fertilization does not happen, the uterus sheds its lining, and that's what we call a period. The menstrual cycle has 4 phases: the menstruation phase, the follicular phase, ovulation, and luteal. Hormonal birth control methods impact the cycle, while non-hormonal methods generally do not. Now for the methods. We will cover different types of birth control, some of which contain hormones and some that do not. Hormonal methods like the pill, IUD, implant, shot, ring, and patch use progestin, estrogen, or both to prevent pregnancy by stopping ovulation, thickening cervical mucus, or thinning the uterine lining. Non-hormonal methods like condoms, copper IUD, diaphragm work by creating a physical or chemical barrier to prevent sperm from reaching an egg or changing the environment in the uterus. Choosing between hormonal and non-hormonal methods depends on your body, your lifestyle, and your personal preferences. And we will help you explore what might be the best fit. Take note that if you have specific questions about how a method may interact with a medical condition, a medication, or postpartum recovery, contact your medical provider, as we are not medical professionals and we can't provide specific medical advice. Let's talk about the hormonal IUD. There are 4 FDA-approved options in the US: the Mirena, Skyla, Kyleena, and Laletta. They all work by releasing progestin, which prevents ovulation and thickens cervical mucus to block sperm. A quick FYI, if you'd like to see a detailed IUD insertion demo, we've linked a great resource in the description below. If you'd rather not see a procedure, don't worry, we will walk you through the basics. Getting an IUD is a quick, in-office procedure. A provider inserts the device into your uterus using a small applicator. Most IUDs have thin strings that extend through the cervix, allowing for removal. You should be able to feel the strings by inserting a finger into the vagina. If you can't feel them or have any concerns, call your provider for a quick check. Hormonal IUDs can last between 3 to 8 years, depending on the brand. Mirena and Laletta have higher hormone levels and can also be used to treat heavy menstrual bleeding for up to 5 years. Many people stop having periods altogether with Mirena and Laletta, while others may experience lighter or less frequent bleeding over time. Skyla and Kyleena can help reduce heavy bleeding, but they typically do not stop periods completely like Mirena and Laletta often do. Some cramping is normal after insertion, but it usually fades within a few days. Side effects are usually mild, but some people experience headaches, nausea, breast tenderness, or mood changes in the first few months. These typically improve over time. A rare side effect is IUD expulsion, where the body pushes the IUD out on its own, usually within the first 6 months. Perforation, where the IUD embeds into the uterus, is extremely rare, about 1 in 1,000 cases, but it's good to be aware of. If you experience severe pain abnormal bleeding, or fever, contact your provider. If you ever want to remove your IUD, a provider can take it out at any time. One very important note: hormonal IUDs do not protect against STIs. Consider using condoms, which we will talk about later, for STI prevention. Now let's talk about the implant. The only brand available in the US is Nexplanon, a tiny rod the size of a matchstick, inserted just under the skin of your inner upper arm. It releases progestin, which prevents ovulation and thickens cervical mucus to block sperm. Getting the implant is a quick procedure. A provider numbs the area with a local anesthetic and then uses a special applicator to insert the rod. Afterward, you may have bruising or soreness for a few days. You should be able to feel the implant under your skin, but if you can't find it or if it seems to have moved, contact your provider for a check. Like the hormonal IUD, the implant can stop your periods entirely, but some people experience irregular bleeding or spotting instead. Other possible side effects include headaches, mood swings, or nausea, but these usually improve after a few months. If you decide to remove the implant, a provider will make a small incision to take it out. You can get a new one placed in at the same appointment if you'd like to continue using this method. Fertility typically returns within 1 to 3 cycles after removal. One important note, and you will hear me say this a few times throughout this series to help me drive home the message: the implant does not protect against STIs. Consider using condoms for STI prevention. Now let's talk about the Depo shot, a contraceptive injection that prevents pregnancy. The brand name version is Depo-Provera, though there are some generic options available in the US. The shot is given every 12 to 13 weeks to stay effective. The shot can be given by a provider at a clinic, usually in the arm or buttocks, as an intramuscular injection. Sometimes a self-injection option is available where you would administer the shot in the stomach or thigh as a subcutaneous injection at home. So how does it work? The shot contains progestin, which prevents ovulation and thickens cervical mucus to block sperm. Many people stop having periods while on the Depo shot, but others experience spotting or irregular bleeding as their body adjusts. This usually evens out after a few injections, but if you experience heavy or prolonged bleeding, reach out to your provider. If you decide to stop the Depo shot, just stop taking injections. Your cycle will eventually return to normal, but for some, it may take several months to a year. This does not mean that you are protected from pregnancy that entire time. Some people can get pregnant right away, so be sure to use another form of birth control if you're not ready for pregnancy. Side effects may vary. Some people have none, while others experience headaches, nausea, sore breasts, or mood changes. Another thing to note is that the Depo is the only birth control method sometimes linked to weight gain. Studies show that some people may gain 5 to 25 pounds while using it. This doesn't happen to everyone, but it's something to be aware of. Depo is not recommended as a long-term birth control method. Using it for more than 2 years can reduce bone density, increasing the risk of osteoporosis. So if you plan to stay on the Depo longer, talk to your provider about calcium or vitamin D supplements to help protect your bones. One final reminder: like the IUD and implant, the Depo shot does not protect against STIs. If you're concerned about a partner's STI status, consider using condoms for protection. The pill, the first hormonal birth control option and still one of the most widely used today. There are many different brands and formulations, but the vast majority of combination birth control pills work the same way in the body. So how does the pill work? The combination pill contains progestin and estrogen. Progestin prevents ovulation, meaning no egg is released. Together, they thicken cervical mucus to make it harder for sperm to reach an egg. Taking the pill is easy for most, but consistency is key, meaning that you should be able to take your pill at the same time every day. Most pill packs include 3 weeks of active pills with hormones and 1 week of inactive pills without hormones. During the inactive pill week, your hormone levels drop, triggering a withdrawal bleed, which mimics a period but isn't a true menstrual cycle. You can skip the withdrawal bleed if you want. Some people skip inactive pills and go straight to a new pack to avoid bleeding altogether. This is considered safe for most people, but if you have concerns, talk to your provider. Missed a pill? Here's what to do. If you forget to take your pill, take it as soon as you remember. If you miss one day, you can take 2 pills at once. If you miss more than 2 pills, use a backup method like condoms until you're back on track. We've also linked a handy guide in the description that shows what to do when you miss a pill or pills. If you have any other concerns, please refer to the information packet that comes with your pill pack or contact your medical provider. If you decide to stop taking the pill, simply stop. Most people return to their normal cycle within a couple of months, though some may get pregnant immediately after stopping. If you're not planning a pregnancy, switch to another birth control method right away. Side effects vary. Some people experience headaches, nausea, sore breasts, or spotting when they first start the pill. But these usually go away within 2 to 3 months. If side effects persist, talk to your provider about taking a different pill. One more important note. Just like the other hormonal methods, the combination pill does not protect against STIs. If STI prevention is a concern, consider using a condom for added protection. Let's talk about the Progestin-Only pill, often called the mini pill. Unlike combination pills, which contain both estrogen and progestin, the mini pill contains only progestin. This makes it a great option for people who can't take estrogen due to medical conditions or personal preference. The mini pill works by thickening cervical mucus to block sperm, and in some cases, preventing ovulation. However, ovulation may still occur occasionally, which is why it's extra important to take this pill at the same time every day for maximum effectiveness. We've linked in a description guide on what you can do if you've missed a pill or pills. A backup method like condoms should be used if you are more than 3 hours late taking a pill. How do you get it? Most progestin-only pills require a prescription, but a brand called Opill is now available over the counter. You can purchase it at a pharmacy or online without a prescription. Just like the combination pill, you take 1 pill every day. However, there are no inactive pills. You take the same active pill every day without a break. Some people may experience light bleeding or spotting, but many find their periods become lighter or stop altogether over time. If you stop taking the pill, fertility returns pretty quickly. You can get pregnant as soon as you stop. So if you aren't planning on getting pregnant, be sure to switch to another form of birth control. Side effects may vary. Some people experience changes in bleeding, headaches, nausea, or breast tenderness, but these typically improve with the first few months. If side effects persist, talk to your provider about trying a different pill. One final reminder, like other birth control pills, the progestin-only pill does not protect against STIs. If STI prevention is a concern, consider using condoms for added protection. Now let's talk about the vaginal ring, a flexible hormonal birth control option that you insert into your vagina. There are 3 FDA-approved rings, NuvaRing, Annovera, and EluRing. How does it work? The ring releases estrogen and progestin, similar to the combination of the pill, to prevent ovulation, to thicken cervical mucus, and thin the uterine lining. You insert into your vagina like a tampon, and it stays in place for 3 weeks while continuously releasing hormones. After 3 weeks, you remove it and either take a 1-week break for a withdrawal bleed or replace it immediately to skip your period. There are a few differences between the rings. NuvaRing and EluRing, used once per cycle, then replaced with a new ring each month. Annovera, reusable for 1 full year. You remove it after 3 weeks, store it in the provided case during your 1-week break, and reinsert it in the next cycle. So what happens when you stop? If you decide to stop using the ring, simply remove it. Most people return to their normal cycle within 1 to 2 months, and pregnancy can happen quickly. Side effects may vary. Some people experience headaches, nausea, sore breasts, mood changes, or increased vaginal discharge when they first use the ring. These symptoms usually improve within 2 to 3 months. One important note, just like the other hormonal birth control methods, the vaginal ring does not protect against STIs. If STI prevention is a concern, consider using condoms for added protection. Now let's talk about the birth control patch, a hormonal method that you wear on your skin to prevent pregnancy. There are two FDA-approved patches, Xulane and Twirla. So how do they work? Well, the patch releases estrogen and progestin, just like the combo pill and the vaginal ring. These hormones prevent ovulation, thicken the cervical mucus, and the thin uterine lining, making it harder for the sperm to reach an egg. Using the patch is simple. You stick it onto your stomach, your upper arm, your butt, or back, and it releases hormones throughout the skin into your bloodstream. Each patch lasts 1 week, and you replace it weekly for three weeks in a row. On the fourth week, you take a patch-free break, which is when most people have a withdrawal bleed, which mimics a period. There are a few key differences between the patches. The Xulane is a higher dose patch that works similarly to the older Oophorectomy patch. The Twirla is a lower dose patch, but it's only approved for people under 198 pounds due to effectiveness concerns. Stopping the patch is easy. Just remove it at any time. Most people return to their normal cycle within 1 to 2 months, and pregnancy can happen quickly after stopping. Side effects vary. Some people experience skin irritation where the patch is applied, nausea, headaches, sore breasts, or mood changes. These typically improve after a few months. One important note, like other hormonal methods, the patch does not protect against STIs. If STI prevention is a concern, consider using condoms for added protection. That wraps up our section on hormonal birth control. We've covered a variety of methods from the pill to the IUD and how each one works. Remember, the best birth control method is the one that fits your lifestyle and your needs. Some people prefer long-term options like the implant or IUD, while others like the flexibility of the pill, the patch, or the ring. If you have questions about which method might be right for you or how birth control could interact with your health, be sure to consult with a healthcare provider. Next, we will be talking about non-hormonal birth control options and permanent solutions. Let's dive into the non-hormonal methods, which work without changing your body's natural hormones. Some of these methods are reversible, meaning you can stop using them at any time if you decide you want to get pregnant. Others are considered permanent, designed for people who aren't sure they want to have children in the future. Whether you're looking for a hormone-free option or considering a long-term solution, we will walk you through how each method works and what to expect. Now let's talk about non-hormonal IUD, also known as Paragard. Unlike hormonal IUDs, Paragard contains no hormones. Instead, it uses copper to prevent pregnancy. It's approved for up to 10 years, making it one of the longest-lasting reversible birth control options available. So how does it work? Paragard is wrapped in a thin copper coil, and when placed inside the uterus, it creates an environment that is toxic to sperm. The copper prevents sperm from moving properly, so they can't reach an egg, and fertilization does not occur. Think of the copper IUD like a bouncer at a club. It keeps the sperm from getting in. Getting an IUD is a quick in-office procedure. A provider will use a speculum to open the vagina, then insert the IUD through the cervix and into the uterus. Like hormonal IUDs, Paragard has thin strings that extend through the cervix, allowing for removal later on. You may be able to feel the strings, but if you can't and are concerned, contact your provider. If you'd like to see a demo of an IUD insertion, we've linked a great resource in the description below. If you'd rather not see the procedure, don't worry. We're walking through the basics here. So how does it affect your period? Unlike hormonal IUDs, which can reduce or stop periods, Paragard does not change your natural cycle. Many people experience heavier periods and increased cramping, especially in the first few months after insertion. These symptoms may improve over time, but for some, they continue long term. If you ever want to remove Paragard, a provider can take it out at any time. Once removed, your fertility immediately returns to normal, meaning you can get pregnant right away. Side effects vary. While Paragard is hormone-free, it can cause increased cramping, longer periods, or spotting between cycles. A rare side effect is IUD expulsion, where the body pushes the IUD out, usually within the first 6 months. Perforation, when the IUD embeds into the uterus, is extremely rare, about 1 in 1,000 cases. But if you're experiencing severe pain, abnormal bleeding, or fever, contact your provider. One important note: like hormonal IUDs, the copper IUD does not protect against STIs. If STI prevention is a concern, consider using condoms for added protection. Now let's talk about barrier methods, which work by physically blocking sperm from reaching an egg or bodily fluids from touching directly to the skin. These methods are hormone-free, easy to use, and also provide protection against most STIs, which is something other birth control methods do not do. The most common barrier method is the external condom. You might know it as the male condom, but anyone can use it during penetrative sex. External condoms are worn on the penis and act as a barrier to prevent sperm from entering the vagina, anus, or mouth. They're made of latex, polyurethane, or polyisoprene, and are available lubricated, non-lubricated, and even spermicide-coated for extra pregnancy prevention. How to use an external condom. Check the expiration date and make sure the wrapper is sealed. Never use one that's expired or damaged. Open the wrapper carefully. Don't use your teeth or sharp objects. Pinch the tip to leave room for semen and roll it down the erect penis before any contact. After ejaculation, hold the base of the condom while withdrawing to prevent any spills. Dispose of it properly. Don't flush it. Next, let's talk about the internal condoms, sometimes called female condoms. These are pouch-like condoms that go inside the vagina or anus before sex. They are typically made of polyurethane or nitrile, which makes them safe for people with latex allergies. They work the same way, acting as a barrier to prevent sperm or STIs from passing through. How to use an internal condom. Open the package carefully and find the flexible ring at the closed end. This is what goes inside the body. Squeeze the ring and insert it into the vagina or anus, similar to inserting a tampon. The outer ring should stay outside the body. This helps with removal and prevents the condom from shifting. After sex, twist the outer ring to trap fluids inside, then gently remove and dispose of it. One key difference: internal condoms offer more control because the person receiving penetration inserts it themselves. Also, you should not use an external condom and an internal condom together. Friction can cause them to tear. Let's cover dental dams. Dental dams are thin latex or polyurethane sheets that act as a barrier between oral sex or the vagina or the anus to prevent STIs. A dental dam can also be made from an unlubricated condom. With scissors, carefully snip off the elastic band part at the tip of the condom and then down the length. How to use the dental dam. Open the package carefully and unfold the sheet. You can place the dental dam over the vulva or anus before oral sex. After you use it, dispose of it. Dental dams are single use only. Barrier methods are highly effective when used correctly. External and internal condoms prevent pregnancy and STIs, while dental dams help reduce the risk of STI transmission during oral sex. One final reminder: never reuse a condom or a dental dam, and always check for damage before use. Now we're going to talk about two non-hormonal birth control options, the diaphragm and the cervical cap. These methods act as barriers covering the cervix to block sperm from reaching an egg. The diaphragm is a soft, flexible dome that you insert into the vagina before sex. It covers the cervix, and it must be used with spermicide for effectiveness. The cervical cap is smaller and much more rigid than the diaphragm, and it fits snugly over the cervix, also requiring spermicide to work properly. Both the diaphragm and the cervical cap require a prescription from a healthcare provider. A provider will help you find the right size to ensure a proper fit. Some brands, like Kaya, offer a one-size-fits-most diaphragm that doesn't require a fitting. Once prescribed, you can pick them up at a pharmacy or online. How to use them. Apply spermicide to the device before inserting it into the vagina. Fold the device and insert it, making sure it covers the cervix completely. Leave it in place for at least 6 hours after sex to ensure that sperm can't reach the uterus. Remove it within 48 hours to avoid irritation or infection. Since these methods don't contain hormones, they won't affect your cycle. If you decide to stop using them, you can switch to another birth control method right away. Side effects do vary. Some people experience vaginal irritation, discomfort, or an allergic reaction to spermicide. In very rare cases, leaving the device in too long can increase the risk of toxic shock syndrome. So it's important to follow removal instructions carefully. One important note: diaphragms and cervical caps do not protect against STIs. If STI prevention is a concern, considering using condoms for added protection. Next, we're going to talk about Phexxi and spermicide, two non-hormonal birth control methods that work by changing the vaginal environment to prevent pregnancy. Earlier, we mentioned that some condoms come pre-coated with spermicide, but spermicide can also be used on its own or with other barrier methods like the cervical cap and diaphragm. So what is spermicide? It's a gel, cream, a foam, suppository, or a film that contains chemicals that disable sperm, preventing them from reaching an egg. It's inserted into the vagina before sex and is typically used with condoms, diaphragms, or cervical caps to improve effectiveness. Spermicide does not require a prescription, and it can be purchased over the counter, usually located with the condoms. How to use spermicide. Follow the instructions on the package. Some forms need to be inserted a few minutes before sex to activate. Apply the recommended amount inside the vagina near the cervix. Spermicide remains effective for about an hour, but must be reapplied before each act of sex. Next, let's talk about Phexxi. Phexxi is a prescription vaginal gel that works differently from spermicide. It doesn't kill sperm, but instead it lowers the vaginal pH, creating an environment where sperm can't move effectively. You will need to ask your doctor for a prescription, as Phexxi is not available over the counter like spermicide. How to use Phexxi. Use the pre-filled applicator to insert the gel into the vagina before sex. It works immediately and remains effective for up to an hour. If you have sex again, you must apply a new dose before each act. Since both spermicide and Phexxi are non-hormonal, they won't affect your menstrual cycle. If you decide to stop using them, you can switch to another birth control method right away. Side effects will vary. Some people experience mild vaginal irritation, burning, or itching, especially when first using these methods. If irritation persists or worsens, talk to your healthcare provider. One more important note: Phexxi and spermicide do not protect against STIs. If STI prevention is a concern, considering using condoms for added protection. Now we're going to talk about the fertility awareness method, otherwise known as FAM, a hormone-free birth control option that involves tracking your cycle to determine when you're most and least likely to get pregnant. FAM has recently gained popularity, especially on social media, as a natural alternative to birth control. While it can be effective when used correctly, there are some important things to know before deciding if it's right for you. FAM involves monitoring changes in your body and your menstrual cycle to predict your most fertile window, otherwise known as the days when you are most likely to conceive. During these days, people can either avoid sex, use another form of birth control like condoms, or abstain from vaginal intercourse to prevent pregnancy. There are different ways to track fertility, and most people use a combination of methods for better accuracy. Some will use basal body temperature, taking your temperature every single morning before getting out of bed to detect slight increases that indicate that ovulation has occurred, or cervical mucus tracking, observing changes in vaginal discharge, which becomes clear and stretchy during ovulation, kind of like egg whites. Cycle length tracking, or the calendar method, tracking the length of past cycles to estimate future ovulation days. There are also ovulation test strips and apps. Some people use ovulation predictor kits or fertility tracking apps to help estimate their fertile window. Things to consider before using FAM. It requires consistency and commitment. Tracking your cycle daily is crucial for effectiveness. Your cycle also must be regular. If you have irregular periods, FAM may not be a reliable option for you. It does not protect against STIs, so if STI prevention is a concern, consider using condoms. It can take time to learn, and many experts recommend tracking for at least 3 to 6 months before relying on it for birth control. FAM can be up to 98% effective, but this does depend on how carefully it's used. With typical use, effectiveness drops to about 76 to 88%, meaning 1 in 4 users may get pregnant in a year. Combining multiple tracking methods and using a backup method like condoms can improve your success rates. If you are interested in learning more, talk to your healthcare provider about whether this method is a good fit for you before starting. If you decide to stop using FAM, you can switch to another method right away. Since FAM does not involve hormones, it won't affect your cycle. And if you're planning for pregnancy, you can use the same tracking methods to help conceive. Now let's talk about the pull-out method, also known as withdrawal, or as some people call it, the pull and pray. This method involves removing the penis from the vagina before ejaculation to prevent sperm from reaching an egg. While some people think of this as an effective way to prevent pregnancy, there are a few important things to consider before relying on the withdrawal method as your primary birth control. For this method to work, it has to be done perfectly every time. That means the person with a penis must have control over when they pull out and must do so before any semen is released. However, in the moment, timing can be tricky, and if withdrawal happens too late, pregnancy can occur. Another thing to keep in mind is that there's pre-ejaculate fluid, otherwise known as pre-cum. Pre-cum is released during ejaculation to help clear the urethra, but it can contain sperm. Here's how. Sperm travels through the vas deferens to exit the body. The Cowper's glands releases the precum to flush the urethra. If sperm were left behind from a previous ejaculation, they can mix with precum and still cause pregnancy. So, how effective is the pull-out method? With typical use, the pull-out method is about 78% effective in preventing pregnancy, meaning roughly 1 in 4 people relying on withdrawal will get pregnant in a year. To improve effectiveness, some people use withdrawal alongside condoms, spermicide, or fertility awareness methods. One important note, pulling out does not protect against STIs. If STI prevention is a concern, consider using condoms for extra protection. While the pull-out method is better than using nothing, it carries a high risk of pregnancy than most other birth control methods. If you're considering withdrawal, talk to your partner and consider pairing it with another form of birth control for extra protection. All right, it's time for Anatomy Quickie Part 2. Let's take a look at the reproductive system of a person with a penis. The testicles are where sperm are produced. The sperm mature in the epididymis before traveling through the vas deferens to exit the body. A vasectomy works by cutting or sealing the vas deferens, blocking sperm from mixing with semen during ejaculation. During a vasectomy procedure, a doctor makes a small incision in the scrotum, then cuts, seals, or ties off the vas deferens so sperm can no longer travel through the reproductive system. This prevents pregnancy, but the testicles still produce sperm. They just break down and are reabsorbed by the body over time. After a vasectomy, sexual function remains the same. People can get erections and ejaculate, but the semen will no longer contain sperm. Testosterone levels are not affected, so there's no change in libido or masculinity. A vasectomy does not provide immediate protection against pregnancy. It takes time for all remaining sperm to clear from the system. A vasectomy is typically a short outpatient procedure, sometimes performed without the need for prescription pain medication. Most people will recover quickly with rest, ice packs, and over-the-counter pain relievers, and can return to normal activities within a few days. Follow-up testing is crucial. A doctor will perform semen analysis in the months that follow the vasectomy to confirm that no sperm remains in the ejaculate. Until a doctor gives the all clear, it's important to use a backup method of birth control to prevent pregnancy. One important note, a vasectomy does not protect against STIs. If STI prevention is a concern, continue using condoms for protection. Now let's talk about tubal ligation. commonly known as getting your tubes tied. This is a permanent birth control method for people with a uterus and fallopian tubes. So how does it work? Well, the fallopian tubes connect the ovaries to the uterus. During ovulation, an egg travels through the fallopian tubes where it could meet sperm and lead to pregnancy. Tubal ligation blocks or seals the fallopian tubes, preventing sperm from reaching an egg. Tubal ligation is usually a minimally invasive outpatient surgery performed under general anesthesia. A small incision is made in the abdomen, usually near the belly button. A tiny camera is inserted to help guide the procedure. The fallopian tubes are then cut, tied, burned, or clipped shut to block sperm from reaching an egg. What changes after a tubal ligation? Well, it does not affect hormones, so periods and menopause will happen as expected. Sexual function remains the same, so there's no change in libido or pleasure. It is permanent. While reversal is possible, it's not guaranteed, and it's often expensive. Recovery and effectiveness. Most people will go home the same day and recover a few days to a week. Mild cramping, soreness, or bloating is normal after surgery. It's over 99% effective at preventing pregnancy right away, but using backup birth control for the first week is sometimes recommended. The side effects and risks can contain mild side effects like temporary pain, nausea, or bloating from the procedure. As with any surgery, there's a small risk of infection or complications, but these are rare. Some people report changes in the menstrual cycle, but these are usually unrelated to the procedure itself. One important note, tubal ligation does not protect against STIs. If STI prevention is a concern, continue using condoms for protection. Let's go over 3 permanent surgeries that can prevent pregnancy: hysterectomy, salpingectomy, and oophorectomy. These procedures are often done for medical reasons like treating chronic pain, endometriosis, or cancer. Hysterectomy. This surgery removes the uterus, which means you can no longer get pregnant or have periods. If your ovaries are left in place, you may still produce hormones and you will not go into menopause right away. Salpingectomy. This is the removal of one or both fallopian tubes. If both are removed, natural pregnancy is not possible. Your periods and hormones usually stay the same if your uterus and ovaries are still there. It's sometimes done instead of getting your tubes tied, so it's important to ask what's actually being done if you're considering permanent birth control. Oophorectomy. This removes one or both ovaries. If both are taken out, it causes menopause because your body stops making certain hormones. If one is left, your cycle may continue as usual. These procedures do not protect against STIs, so using condoms is still important if that's a concern. That wraps up our birth control overview. We've covered a variety of methods, both hormonal and non-hormonal, as well as permanent options to help you make an informed decision about what might work best for you. Remember, the best birth control method is the one that fits your body, lifestyle, and needs. If you have any questions about a specific method, its effectiveness, or how it may interact with your health, be sure to consult a medical provider for personalized guidance. For additional resources, check the description below. We have included links with more information on each method, plus helpful guides on what to expect at your appointment, how to prepare for certain procedures, and more. If you are interested in free birth control and you're located in our service area, visit our website to learn more about the methods we currently cover and how we can help connect you with the right method. Thank you so much for watching. And remember, your reproductive health is in your hands. We are here to help you stay a step ahead.